Assalamualaikum viewers and welcome back to my channel Biodenverse Hub. In today's video we will be continuing on the same OSCE guide series. In that regard, our today's OSCE guide will be about the oral and maxillofacial surgery. Keep that in mind that it is just a general guide to give you an idea about what type of question can come in your OSCE examination. There are high chances that other questions might come other than these questions that are enlisted in this video, or it could be modified. That totally depends upon your board of examination that is conducted in the different colleges having different settings. So let us proceed on with the video. First of all, we will be studying some must-do important topics. In that regard, our first important topic is of the instruments having the elevators and the forceps. If it is a static station, you will be asked about the identification of the instruments, the point of identification, the use of the instruments, or the principles of the instruments. If it is an interactive one, they will be asking you about that what type of instrument is this. Then they might ask you about some point of identification, but most importantly, they will ask you to use that instrument on particular model or that will be placed there. So you need to know about the principles, plus you need to know that how to use that particular instrument. Then most importantly, from the instrumentation point of view, you need to know about the differences between the maxillary and the mandibular forceps, and you also need to know about how to differentiate the molar forceps from the premolar forceps and premolar forceps from the anterior forceps. There are some forceps, that is the cow horn forceps, universal forceps, and bayonet forceps. You need to know the point of identifications of these forceps plus their uses as well. Then the BDR's forceps, their beaks are jointed usually, so you need to know about them as well. After that, we have the identification of different types of retractors, and that is very much important. Almost every college have an instrument kit composing of different kinds of retractors. So you need to know that different kinds of retractor and their identification, their point of identification, their distinguishing features from each other, and their indications as well. So that include the Selden retractor, the Wheater's retractor, the Minnesota, the Hanahan, and the Austrian retractors. Okay, so after that we have the identification and use of mouth props. That is very much important, and again it could be either a static or interactive station. In the interactive station, the examiner will ask you to first identify and then label its parts, and then he will ask you that how you are going to use the mouth props. The models will be placed there and you will have to perform that. So you need to know about the use of mouth props as well. Then identification and use of breaststroke elevator, the Rowe's forceps, the crossbar, the crier. All of them, again, you need to know about their parts, their point of identification, their distinguishing features, and most importantly, skeletons are placed, skulls are placed, and they will ask you that how to use the Rowe's forceps, how to use the breaststroke elevator, what are the movements that are being used with the breaststroke elevators to elevate the zygomatic ZMC's fracture in which the breaststroke elevator is used. So they will be asking you that what are the movements that are performed through the breaststroke elevator. Then crossbar and criers, you need to know about how to use them. Then consent form, it is very much important in case of extractions of the mandibular third molar and other procedures as well. So you need to know that what are the things that are included in the consent forms, and that is very much important that before the start of procedure you need to sign that consent form from your patient. Then the identification and diameters of mini plates, screws, microplates, the recon plates, the lag screws, that is very much important in the maxillofacial surgery that is used for the fixation of the fractures. So most importantly, you need to know how to read an orthopentomograph, that is the OPG. It is a must do topic, and there are high chances that this station will come. Usually an interactive one, they will ask you that how you will going to read the OPG, and there you need to tell about the areas that you will be going to observe first. Then they might ask you about the interpretation of the OPG as well. In that regard, they will have certain kind of fractures or pathological lesions that will be present out there, and they will ask you about the differentials. So you need to prepare that very well. Then the differential diagnosis of different pathological lesion, again we have discussed it. Then we have the identification of different radiographic views that are used in the maxillofacial surgery. That is the PA view, the AP view, the submentovertex view. Then we have different kinds of the lateral views, then CBCT, CT scans, MRI. So these are some kind of views that will be given to you. First of all, you have to identify what kind of radiograph is given, and then they will ask you about the radiographic interpretation of different fractures. After that, the diagnosis of different clinical case scenarios. And the clinical case scenarios can be given, that could be of a TMJ ankylosis, the salivary gland diseases, the fractures, the pathological lesion, or the facial space infection. So you will be given different kinds of scenarios, and after that you will be asked to diagnose it and relatively the management as well. Okay, so after that there is another important test that is known as the starch iodine test. There will be a clinical picture given of the test, and you need to first identify that what is the procedure being carried out, and then you need to tell that this test is used for which kind of confirmation test, or what kind of diagnosis can be derived from it, and in which kind of diseases it is usually used. So then indication of plate removals, it is most frequently asked questions in your OSCE examination. Then we have the difficulty assessment of the impacted molars by different scale and scoring systems, and especially the Peterson scoring can come. You can be given an OPG, and you will be asked to analyze the difficulty assessment by the Peterson scoring method. So you need to prepare that very well. After that, most important station that is almost every time repeated is about the local anesthesia. In the local anesthesia, you need to cover everything. Anything can come out from there. It could be either the classification of local anesthetic agents, it could be either the techniques of local anesthesia, the block and the infiltration techniques, it could be about the gauges of the block infiltration needles, it could be about the indications of every technique, and then the LA toxicity. Anything could come from the local anesthesia. Most importantly, the calculation formula, you need to practice that very well. So another important station will be that is more frequently asked is of the suture. If it is interactive one, you are asked to perform the suturing procedure. You need to do it with correct protocols and technique. And then you can also be asked about different types of suturing techniques, about the classification of suturing materials, what type of sutures are used in the oral cavity, what type of sutures are used on skins, and then indication of every suturing technique, suture needles, their classification, so you need to prepare that very well. After that, we have a station in which you have to perform the wiring, that is the IV eyelet wiring. And in that station, it could be either about the performance of the IV eyelet wiring technique, or they can also ask you about different kind of wiring techniques, the diameter of the wire being used, and other thing related to that. So you need to prepare that very well as well. Then a must come station is of the examination. So examination is a very important part of your oral and maxillofacial surgery. Examination could be either of facial nerve, the trigeminal nerve, the lymph node examination can come, and TMJ examination can also come. Examination of any kind of swelling or lesion, any pathological lesion, you could be asked to examine that. And most importantly, if the patient reported with any kind of traumatic injury, especially of the fractures, or patient just come after road traffic accident or any kind of trauma, then you are asked to examine that patient, how you will proceed on with the examination of such kind of patient. So you need to have a sound grip on that as well. Then according to the implants, the stations that can come, it might be about the implant classifications, the part of implant, then the bone classification for implant, factors affecting the osteointegration, then how you will check that implant is very well osteointegrated, the placement technique of implant in that regard, the sequence of drill which you need to follow, the speed and the torque of that drill, and then causes of the failure of implant, that is more frequently asked, and any kind of complications that are related to that can be also asked. Okay, so after that, as far the odontogenic infection is concerned, the must do topics from it will be about the clinical case scenarios will be usually given, and they could either ask you about the diagnosis, which is a must ask question. You will be first of all asked about the diagnosis, and then they could either ask you about the boundaries and the contents of the space, the spread of infection, or either they could ask you about the management of a certain kind of infection. In that regard, you need to do the canine space infection very well, the buccal space infection, the cavernous sinus thrombosis, Ludwig's angina, the osteomyelitis. So these are some infections you need to do it very well. After that, we have the war and the winter lines, which you need to do, and then the incision for third molar removal, different kinds of incisions and flap designs that are used in the removal of third molar, impacted third molar. So you need to know about them, and also their clinical pictures as well, as it can come in your OSCE stations, and they will be asking about to identify that incisions and the indications of that incisions and flaps as well. Then we have the osteoradionecrosis. In that regard, the management, prevention, and extraction protocols in that regard can be asked. After that, we have the composition of alveolar gel, that is very much important, and the composition of cornea solution can also be asked. Then the BIP that is used in the chemical cauterization, it could be asked as well in any kind of OSCE question. Okay, so after that, pictures of different type of incisions will be given, and their indications and also their identification will be asked, which we will be discussing later on in this video as well. Then the relationships of the inferior alveolar nerve to the roots of third molar, which is very much important, and it is quite frequently asked in different kinds of OSCE examination. After that, we have the labeling of the vertical and horizontal buttresses of facial skeleton, that can also be asked. And then the external fixation techniques and their pictures will be basically given, and you will be asked to identify that which kind of external fixation technique is that. Then the Campbell's lines, the Champy's lines of ideal osteosynthesis, the autoclave, the types of sterilization procedures, the temperature of the autoclave, and the tests that are used to check that either the autoclave is effectively working or not, it can be asked. Then the TNM staging of the tumors can be asked. You could be given in the scenario, and then they will be asking you about that to grade and stage the tumor. So you should be knowing about the TNM staging of tumors as well. Then the biopsy, the techniques of biopsies can be asked. The template of biopsy form can come, and you basically have to write or all of this template form, and their indication as well. Different biopsy techniques, their indication, their advantages and disadvantages can be asked. Then the management of diabetic patients, the management of different kinds of medical emergencies that occur during the general procedure, it could be asked. You need to know about the emergency drugs and their dosages as well. Then the relevant investigations for the patient on the heparin, warfarin, aspirin, and the bisphosphonate. For such kind of patient, what relevant investigation tests you need to prescribe for this patient. Okay, so then the ways of controlling hemorrhages. The extraction osteogenesis can be asked. In that regard, the phases, device identification, the indication, and the uses, it can be asked. After that, we have the favorable and unfavorable condylar fracture, and it could be given a clinical picture showing the direction of displacement. In that regard, you will have to identify the direction of displacement. Either it is the favorable or unfavorable condylar fracture, and the muscle pull acting on them in the either of case. So then we have the reconstruction of the defect after removal of pathological lesions that can be asked. In that regard, you will have to tell about either you will go for the vascular or non-vascular graft, their indication, and the different kinds of flaps that are being used in the reconstruction, their uses and indications. Then a station about the cleft and lip palate can also come, and you can be asked about the causes, the treatment, and the problem associated with the cleft and the left palate. After that, you can either be asked about the best palsy, the facial palsy, and the difference between the upper and the lower motor neuron lesions can also be asked. So you need to do that in quite detail. Okay, so this was all about the must-do topics. Now we will moving on towards some clinical case scenarios and picture. So the first picture is about the facial space infection, and as you can see that it is quite obvious kind of swelling in the infraorbital region. So it is most probably the canine space infection or the infraorbital space infection. In that regard, you will be asked about the differential and the definitive diagnosis, then the causes and spread, and then the management of such kind of infection. So next picture is about the buccal space infection that is quite obvious in the buccal region, and that is mostly due to the odontogenic infection arising the lower third molar. Again, the diagnosis, differential, definitive, the causes and the spread, and the management of such kind of space infection can be asked. After that, we have a clinical picture of Ludwig's angina, in which there is bilateral involvement of all the three spaces, submandibular, sublingual, and submental space. And this infection is quite fatal as it can cause the airway obstruction, so it is an emergency condition requiring the emergency management. Again, the diagnosis, differential, definitive, the causes, spread, and management can be asked about Ludwig's angina. So this here it is the another clinical picture and also a radiograph given of the TMJ ankylosis, which would be quite obvious from the clinical picture, and the bird beak deformity as well that will be pointing out towards the TMJ ankylosis. TMJ ankylosis is very much important topic. You need to cover everything from the TMJ ankylosis. It could be either the diagnosis, the classification, the causes, the management, anything can come. So in that regard, we have a classification of TMJ ankylosis that can be asked. Either you can be asked to write the classification, or either the pictures can be given and you need to label that. So we have two classification system. In the first classification system, we have the staging, that is the stage 1, ankylotic bone limited to the condyle process. In the stage 2, the ankylotic bone extending to the sigmoid notch. In the stage 3, ankylotic bone extending to the coronoid process. So these were the three stages. After that, we will proceed on with the type of TMJ ankylosis. So the type 1, it is the extensive fibrous adhesions around the joint. Then the type 2, more bony fusion at the outer edge of the articular surfaces, and but there is no fusion within the medial area of the joint. The type 3 have the bony bridge between the mandible and the temporal bone, and the type 4, the joint is replaced by a mass of bone. So these were the types of the TMJ ankylosis. Okay, so we have another clinical picture or an OSCE station that in which you could be asked about to label the horizontal and vertical buttresses of the facial skeleton. So we need to know about that. In vertical buttresses, we have the nasomaxillary, zygomaticomaxillary, the pterygomaxillary, and the vertical mandible. In the horizontal buttresses, we have the frontal bar, infraorbital rim and nasal bone, then the hard palate and maxillary alveolus, and also one in the mandible region as well. So then another important station could be of the relation of the inferior alveolar nerve to the third molar, and these are the following relationships. You need to know each and every kind of relationship. You will be asked to label these. Okay, so then you were asked about the composition of alveolar gel, which is usually composed of the obturatin, that is eugenol, the anesthetic agent, that is benzocaine, and the balsam of Peru, that is the vehicle. Another station about the composition of cornea solution can also be asked, in that it includes the ferric chloride 1 gram, chloroform 3 ml, the glacial acetic acid 1 ml, and the alcohol, that is 6 ml. So after that we have another station in which you could be asked about the bone classification for implant. In that regard we have two classification systems. First is of the Lechormanzer. In that we have the quality 1 bone, homogeneous compact bone, the quality 2 bone, that is the thick compact bone surrounding dense trabecular bone, then quality 3 bone, that is the thin cortical bone and dense trabecular bone, and then the quality 4 type of bone, that is thin cortical bone and low density trabecular bone. After that we have the mesh classification, which basically have the D1, that is the dense cortical bone, then the D2, the porous cortical bone, then D3, that is the coarse trabecular bone, and D4, that is the fine trabecular bone. So this was the bone classification for implant. Another important stations about the incisions can be asked. You need to do it very well. The diagrams will be given and you will need to label those incision along with the incision identification. Kindly go through the indications of every incision as well. They can be asked. So let us proceed on with that. First of all, we have the incisions in the subsidiary region. Then we have the infraorbital incision as well. Then we have the transconjunctival approach. After that, we have the different kind of incision, including the submental, submandibular incision. Then we have the retropharyngeal, lateral pharyngeal, and the temporal incision regions as well. In the other diagram, we can see the preauricular incision as well, then the parotid space incision, and rest of the incision, that is the submesenteric and pterygomandibular incisions, are also being shown. After that, we have another incision that is frequently asked in the OSCE examination. Clinical picture is given of that incision, that is basically a question mark shaped incision, and then you are asked to identify that incision and the indication. So it is basically Alkaya-Bramley incision. Another important approach and incision is the hemicoronal incision. So there is the different clinical pictures and the diagram shown, which you need to remember it very well. The hemicoronal incision and the indication as well of the hemicoronal incision. Then we have the intraoral incision, including the vestibular incision. And after that, we will be discussing the incision for the third molar. In that regard, we have the Ward's incision and the modified Ward's incision. And then we have the comma-shaped incision. So you will be able to identify those incisions and also differentiate it from each another. After that, another station could be about the external fixation techniques, in which the clinical pictures or the picture of the technique would be given and you will be asked about it. So first of all, you can be asked about the suspension wiring, and then you can be asked about the halo frame, the Levant frame. So these were some external fixation techniques that might come in your OSCE examination, and you need to prepare it very well. So these were some sample questions and OSCE clinical case scenarios and pictures, just to give you an idea that what kind of questions can be asked and what kind of clinical pictures can basically be given in your OSCE station. Again, there are high chances other questions might come and it could be modified according to your own board of examination. So this was all about the OSCE guide related to the oral and maxillofacial surgery. At last, best of luck for your exam. Thank you so much for watching the video. Don't forget to subscribe, like, share, and also click on the bell icon so you will get notified about our future videos and updates.